Hello and welcome everybody to the latest episode of the Ultimate Wellness Group Transformation Tuesday. We thank you for spending some of your time on Tuesday with us. We got a wonderful show today. Today's subject is coronavirus, the truth coming straight from frontline soldiers in the hospitals around the country. I also have done some intel on doctors from all over the country. So the information that you're going to get today is not from a source that isn't from people that are right there in the midst of taking care of coronavirus patients all over this country. Can you do me a favor, grab me that, please? So thank you for spending some of your Tuesday. We are going to have a wonderful show. We're going to open up with just some opening comments, and then we're going to have three guests. And you all will be able to listen and then ask your questions. And of course, that great dialogue is going to offer some great understanding so that we can move forward in this reality and be comfortable and be confident that we're going to make it through it to the best of our ability. So let's get directly started. Let's ask God for his grace to bring us the ability to have an open mind, to come in to learn, and also to apply these new things that you learn so that we can improve our lives. I ask personally for God to remove my ego and my arrogance so that I may be a good vessel for your benefit. So let's get started. The first thing that I want to just show today, let's just get a few shout outs first. Kia Maline, I hope I said your name correctly, Hawaii here. Thank you for coming in, and I appreciate that shout out you gave earlier today, ma'am. Thank you. Sarah Jean Barkley, Muhammad, thank you for coming in. Peace. Janine Muhammad, thank you for coming in. Bronx is in the house. Kimberly Harris, peace. Jaron Shabazz, thank you. Sagir Hassan, thank you for coming in. Lanya Jefferson, Lawrence Muhammad, and Danny Muhammad, thank you all. I appreciate you all coming in. So let's get right to the show. I wanted to, again, we're always talking about putting things in the proper perspective. So I wanted to just show you some statistics that I think will help us continue to put things in perspective. That's not the right one. Hold on a second. I see my brother Abdullah's now in here, so appreciate you, brother. We got you. Stacy B and Roderick, thanks for coming in. So just to put things in perspective, everybody, here is just a slide that just shows what the number one killer, not only in the United States, but in the whole world is: heart disease. And you see these numbers here. One person dies every 33 seconds. About 647,000 Americans die from heart disease each year. Now, why am I starting with this? Because today's program is about bringing you the truth. And today's program is about helping you put your mind in the right perspective. Should we be concerned about coronavirus? Absolutely, we should be, because it's killing people all over this country. And the statistics are true in that it's killing mostly Black people now. But should we be overwhelmed by this information? That's what we have to deal with today and put things in a proper perspective. So that's why I started here, because I want you all, when you always come to the Ultimate Wellness Group, we say, what? You got news that you can use. So when you leave here today after this program, I want you to be thoroughly convinced that you have the ability to put this in your mind in the right way. And while I'm on that subject, I want you all to know that somebody, and I don't know if Facebook is playing games or what it is. It really doesn't make a difference to me. At the end of the day, brothers and sisters, look, I got another message this week that somebody reported me, and they're threatening to take or lock down my Facebook channel. And I don't care. I'm going to find other ways. I'm going to give you some information a little later about some other apps that we potentially may have to go to if they start to shut us down for telling this truth. But this is something that a lot of these sites, Facebook as well as YouTube, are saying that they're going to shut people's accounts down when they talk about these vaccines. But here it is, this man that we've been seeing all over the television And it's a whole lot of information about this man that makes it very highly suspicious why he's in these positions. But regardless, he says we're not going back to normal without a vaccine or a treatment. Well, why didn't China have to do that? Why didn't North Korea? Why didn't any of the countries that are now starting to decline in the number of cases, why are they not talking about a vaccine like we are here in America, right? There are some serious things that we have to take in consideration today. And so that's why we're having this show, so that you all can hear from people that are on the front lines. People are in these hospitals, in these clinics, in these cities that you are hearing on the news that have such a major problem. And they are having a major problem. But at the end of the day, why are we being limited to what we can say? Why is it that in a country where you're supposed to have freedom of speech, can you not talk against vaccines? And so, again, you know, a lot of people criticize me for saying things about Black people on my show, but I was Black before I was a doctor. Whole lot of racism before I ever became so-called this professional. And I'm sure all of my guests could say the same thing. And so I will never shy away from telling the truth. And I have to tell the truth through these eyes. I can't tell the truth through somebody else's eyes. But what I can say is that we have never in this country had any type of equality, freedom, or justice. So why would we expect it to happen now that we have this major problem going on around the country? If you're expecting that there are going to be enough testing kits in the Black communities, that's a problem I think you have to deal with. You shouldn't be pointing at somebody in the White House or some other governmental agencies on why they're doing that. That's been the historical reality in this country. We have never gotten the right type of care. We have never gotten the right information. Our statistics are hardly ever true. And as I've said to you all before, you can go in just about any place online or anywhere else where you're looking for health information, and you can research about Black men and prostate cancer or prostate problems in general. There's never been a study to prove that. And my senior project, when I graduated from my residency program, was exactly on that. It's nothing but a bunch of lies. And so that's the importance of this program. So I need everybody that's on the show, please share the show. Send it to whoever you think you need to. Send it to people that you think are like so anxious right now about this whole situation. They really don't know how to do, because today we're giving practical advice. Today we're going to be speaking to people. One is in Memphis, one is in Chicago, one is in Baton Rouge, but I've actually gotten some intel on other places in the country too. So that's the type of information that you'll be getting today, the type of information that'll help get your spirit back in control. Because I am sure that we have been mostly inundated with information that's not beneficial. And if we don't come to a conclusion that that's the reality of the media in this country at this time, then, you know, I think we're making a mistake. So without any further on me, and I take that back, there is something further for me. I want to say this. I have a lot of people sending me text messages, emails. I get calls every day about, videos that other people are putting up. And I just want to reiterate to you all. Firstly, let me say, I know for sure that some people that are doing that, it's out of the true concern about making sure that I'm seeing things and that I have all the information that I need. And some people, I'm not necessarily sure. And so a quick story. When I first opened my practice, I remember this older Black man came to see me, and whatever was wrong with him, I gave him a diagnosis and I told him what I thought we should do to help him go in the right direction. This man left my office, went across town to a white physician. The white physician told him the same thing. And then he came back to my office to tell me, hey, I went to see Dr. Such and such. And he told me that the diagnosis that you made was correct. And I told him straight to his face, well, hell, I hope that was for you, because I damn sure didn't need nobody to give me accolades on what I say. I know what I'm doing. Because when I don't know what I'm doing, I'm going to say I don't know it. I'm going to send you to somebody else. So why did I tell that story? Because sometimes I think that's a problem. I'm sure that's a problem in some Black people. And so I'm not really sure if some of the people that are sending it to me think that I need clarification, or I need to get my statements and the things that I say, that I need somebody to give me some type of accolades, or I need that person to co-sign what I'm saying. No, ma'am. No, sir. This brother that you're listening to today studied when he was in medical school, has practiced for 25 years, and I'm very confident these posts that I've been putting up about coronavirus over the last month or so, go back and check them yourself. I've never spoken out of what I didn't know for sure. I have studied virology. Everybody that you're going to hear from tonight has studied virology. Everybody has studied the physiology of the body. They've studied the pathophysiology of the body. That's what we have to do in our medical school years. And so when I come, I'm speaking from the knowledge that I've gained, the things that I've studied, the research that I've done. And I can go back and listen to my other programs and know that I'm giving responsible information. And so the Indian woman that was giving her suggestions about what we should do, and the white guy that was talking about the tonic, and the Indian guy that everybody's promoting, I'm not mad at that. That's cool. You all can choose whoever you want to. But understand that this information that you're getting from me and the other guests that are on here today, we know what we're doing. And we speak out of experience and knowledge and wisdom. And so I don't think you need to go anywhere else. You can go wherever you want to get whatever information you desire to get. But the information that you're getting today from this channel, I believe, is the best, and believe it's going to help you have a better confidence. And if you follow it diligently, I believe you'll be successful. If God says the same, I'm not making any guarantees to anybody, but I'm thinking that you're going to get the best information, the best advice, and the best evaluation of the information from here tonight. So without any further from me, we're going to bring in our first guest, and this is my sister. There she is. So just a little background. She's going to give her own little background as well. But this sister and I have been knowing each other for a minimum of about 4 or 5 years we've been working together.
Yes, sir.
And, I want to make sure you all understand, everybody that's coming on this show tonight is not picked out of like some random thing, because I wouldn't bring any random people to you. I picked the people that are coming on tonight with a responsibility factor that I know them, I've worked with them, I trust them. I've had many conversations with them over the years. So the information that they're going to give you, I know I can sit back and let them talk. Some people I would probably have to shut down because, some things I think are wrong to tell the public, but I don't have to worry about that. So sister, go ahead, introduce yourself, let them know what you're about, and tell them a little bit about how you came into the medical field and got where you are now, just to start
off. Peace family. Thank you, Dr. Keeley, for this much needed program. I'm Tamara Muhammad. I'm a registered nurse. I have a bachelor's in nursing. I'm a critical care nurse. I'm a travel critical care nurse in CV, ICU. I came into nursing because my mother told me to, and I disobeyed and finally submitted. So I'm a second generational nurse. My mother has been a nurse for over 36 years. So that's just about it.
Okay, well, wonderful.
And go ahead.
Go ahead, man.
I'm pleased to know that you started off with that story about the fact checking from your own people. And I think what I've experienced as well for practicing for 7 years in the ICU is that we have to develop a code among one another as people. Research has been proven that our outcomes are a lot better when you're looking at a face that looks like yours.
That's right.
It's very imperative, especially in this time. COVID-19 has exposed all of our weaknesses. And one of our weaknesses is that we don't have primary care providers. You can't get a test unless you have a physician order in most places. Even here where I live, you cannot get a test unless you talk to a physician. So a lot of us do not have what you call PCPs or primary care providers. But most importantly is that over my years, I have been, you will see the Hispanic community, the Mexican community, the Jewish community, Germans, Italians, you name it, Western Indians will come in and they would demand to have healthcare professionals all the way to the top, from their nurses to physicians, to look just like them and speak their language. And like I said, there's plenty of data to back up that your outcomes are experienced a lot better when you're looking at a person who looks like yours. So we need to start that conversation and develop that code among one another, and that we do have our best interests in hand. And if we, especially in this hour, like in the ICU, your loved one is isolated. You're isolated. And so your primary care provider can advocate for you. It's so important that you consult with, counsel with your healthcare providers today, among your family members who are knowledgeable about this, so that they can equip you and make you knowledgeable about what's going to happen, and so you can have the best options available to you.
Absolutely. I agree 100%. And, and the other thing that I want to add to what that beautiful point that you're making is that the people that are on here, we do check each other. If we find each other saying something that we don't think is right, if we find each other saying something that we think we need to talk about, that's what we do. And it's not animosity. It's a brother and a sisterhood of what she just finished saying. We're bound by the fact that we love our people. Everybody that's on here tonight, they love their people. That's why they're here. Because if they didn't, I wouldn't be interested in having them on the show. And so from that love and from that perspective is why they're here, because you guys have to understand that when we stand up like this and talk about these subjects, to some degree, we are putting ourselves in a little jeopardy, because we could have the system come after us. And that's what they're looking for. They're looking at who's going to try to break out of the industry standards and do things that's truly going to help people. Because we know right now, if you all are honest with yourselves, the American medical industry right now is at a loss. They don't know what to do. They don't know how to handle it. A lot of them are just going totally crazy. And so you all need to hear from people that look like you to calm you down and put you back into that perspective. So with that as an intro, sister, tell us about your experience in the ICU when this started to first come towards this country.
The isolation is morally taxing. It is. And that's why it's imperative to seek counsel with your healthcare professionals. And we've got to develop that code among one another. Since we do not have our own hospitals developed, we can get our own care. We do know the disparities exist. It's real. Racism in healthcare is real. It's very, very real. And like I said, I can have a Spanish-speaking patient come in and they'll say, no, necesito ayuda. I need help from someone who looks like me, which taught me to learn Spanish,
Right. Yeah.
And that goes on for the Jewish community, because they know that there is a code among them that they're going to equip. They're going to give them the knowledge that's unbiased, that's from different perspectives to equip them so that they can make really good decisions about how they're going to live and possibly die. And that's important in this day and time, because those decisions are being made. But what you can imagine, anything you can imagine what's going on right now in the ICU is definitely happening.
Yes.
That is absolutely true. And yes, we are being disproportionately affected, because the real root of the problem is that we have to have some accountability in this. Most of my patients in general, because I purposely work in what you call the underserved population. So I work with my people. And so my people are going to be Black, because we are the highest of cardiovascular disease, hypertension, end-stage renal disease, diabetes. We are at the top numbers of that. So, but the root of that, truthfully, as far as accountability, is that COVID-19 would not be affecting us so hardcore as it is if we would make different lifestyle choices.
That's right.
Better lifestyle choices. If we would let go of a diet that has been killing us, macaroni and cheese, pork chops, cornbread, collard greens, that's not our diet. That's a slave diet.
Come on now.
Slave diet. We got to let that go. We got to let go of the, yes, COVID is serious, but COVID is only serious because it has exacerbated your chronic illnesses that were preventable and curable. And prevention is way better than a cure.
Come on now.
We got to get, we do know, and that's what this show is to tell you, is that we do know your diet and we do know your culture. And that's this right here. How to Eat to Live. That's your diet. That's your diet. Pick it up, find it. Final Call website, NOI.org. This is our diet.
That's right.
This is our culture. Those that adhere to that dietary law have reaped the benefits, of not being laden with all of these illnesses that is taking us completely out. COVID is exacerbating those illnesses and is fatal to us. And then to lessen this anxiety over this test, because it is really creating a lot of anxiety. Only certain people are getting the test. Obviously, the test is only available to felines, like a lion. However,
yes.
However, just know, family, that you get we were told by the Armamentalist Farrakhan that only our righteousness should sustain us in this hour and not to unravel.
That's right.
So exaggerating about our illnesses or our symptoms and lying about our symptoms just to get a test is unraveling.
Right.
Let's not do that, because you show up to the ED exaggerating where your outcomes are going to be the same. There is no cure and there is no treatment. What I see at bedside is that our physicians are writing orders experimentally. They're throwing darts in the dark.
That's right.
There is no treatment. There is no cure. So you go get a test, your outcome is the same. It's the same. So the orders is stay home, shelter in place. Those are the orders. Going and running to the emergency room is only going to further expose you. And you're not going to be seen unless you have these severe symptoms. You're not even going to be put up on my unit unless you have some severe symptoms.
Right.
So the outcomes are the same.
Yes, ma'am. And we talked about the respiratory, situation. A lot of people, I've told people that pretty much if you get infected with coronavirus, it's like all of our experiences, you're going to have a typical viral experience like all of us do if you get a cold or a flu. But the thing that starts to change things and as we're starting to learn, that is really the turning point, is when people start to have problems breathing, when they start to have a difficulty breathing, and then they go into the O2 sats start to drop. And then, of course, I think it's probably an idea in the Black community in general that when you get put on that tube that you're not going to make it. And, a lot of things that we think in the Black community, we know are not based in science, but that is, we do know that when a person is intubated and taken to the ICU of any hospital across this country, that their chances of coming out of that ICU alive, there's a certain percent that don't make it. And it's greater that you're not going to make it than you are. So what is your experience as far as people being intubated and being put in the ICU with this situation?
So being able not to breathe is very scary.
That's right.
Folks who don't see this on a regular, like ICU nurse, emergency department, or ER physician or nurse, this is very frightening, being able not to get air inside. So this scares people. And from my experience, the physicians are being very honest, very honest. One of the number one side effects of ventilation on a ventilator is pneumonia. So if you get admitted because you have pneumonia, know that ventilator causes pneumonia. And the more, if we intubate you, we have to also start a sedative medication. We need big lines to start that sedative medication. That would be propofol, that would be fentanyl. We need, and when we start those type of sedative medications, because we can't get a tube down your throat unless we alter your gag reflex.
Relax it, right?
Relax your gag reflex. So we need that medication. We can't just shove a tube down your throat.
That's right.
So we have to have that medication. When we start that medication, that also begins to alter your blood pressure. So now we have to start more drips. And when we do that, that alters your heart rate. So now we have to start more drips. So then we need a larger line in your body, a larger line in your body. That larger line will be a central line. The more you need a Foley catheter now. If you come in COVID-19 like we're seeing, you have diarrhea. We can't have you having diarrhea and feces in the bed. So there is another tube, a rectal tube. We call it a FlexiSeal. So a Foley catheter, FlexiSeal, a central line. Now you're on a ventilator that causes pneumonia. Number one side effect is pneumonia. The longer you stay on that ventilator, and physicians will tell you this, you set yourself up for sepsis because of all the lines we have in you now.
That's right.
And this is the reason why they start you on antibiotics. They also tell you that your prognosis then each day that you're on that ventilator. And yes, the statistics have already been come out that 80% so far that has died from COVID-19 were ventilated patients. So they tell you that you it's less than 50% chance that our patients who are COVID-19 are weaning off of the ventilator. That prognosis get lower and lower each day. We do wean trials every morning. Cannot wean you off that ventilator. The prognosis get slimmer and slimmer each day.
That's right.
And that's another reason why the ER was never meant for us to ever run to and have them manage our symptoms. It was always meant for severe emergencies. But we as a people have to be accountable also in this time. Get you a primary care physician in this time. And I'm saying it. Get you one that looks like you. Yes, I know we have problems. I know we need to address it and deal with those problems. You know, you might say, oh, Black folks will treat you just as worse as someone who don't look like you. Trust me and believe me when I tell you that there is plenty of other races that do this all day. I want me a Jewish physician, a Jewish nurse, and they are a blot if possible.
That's right.
They are. We have to take control of our own health and be responsible. It's important.
That's right.
Know that if you don't start that conversation and you say, well, you know, I've had the worst experience with people who look like me. Well, guess what? If you started that conversation, you could have ended up with a nurse like Sister Tamara.
That's right.
That's going to give you the best care. That's going to give you my time. That's going to explain to you all your medications and side effects and how it works on your body. That's also going to let you know that there is a diet plan that's been prescribed specifically for you to help you with your ills. So you missed out on opportunity. We have problems, we're working on them, but this is a way to get started on that conversation.
That's right.
Because everybody else is also doing that. And like I said, the research is there. You have better outcomes. So we have to start doing that before, God willing, we're going to get to our own hospitals.
Absolutely.
You know.
Yes. And this is the type of conversation that starts us going in that direction. Yes.
Absolutely. And if you had that primary care provider or folks who look like you in the time where you're so isolated from your family member at this time, where you don't know what's going on at the hospital, that anxiety is hard for me.
Yes.
During that. It's true. You have real life patients who you're not at the bedside with your family member and they have expired. That's
right.
the our reality.
That's right.
This is real. So being able to at least have a primary care provider who can advocate for you, who can talk to his colleagues, who can explain certain things to you to equip you with options so that you can make decisions on how your loved one live, quality of life, and how they die in this time. That's important.
Yes, ma'am.
Instead of allowing them to make the decision for your loved one, because that's what's happening.
Yeah, you know, I usually tell this story to young people when I'm mentoring them in medicine. I tell them, you know, when I first walked in the hospital and I first walked into my primary care physician office that I did in my residency program, and even after I finished and went into practice for myself, the first thing that I would do is walk into the office or walk into the whatever part of the hospital I was working in and tell the nurses, like, look, some of them had been in the medical field for 20 years, and I'm just coming out of medical school. So you got two options. You can walk around and be bold and arrogant and have this big old ego if you want to, or you can co-sign yourself and make yourself into a team with these nurses, and they'll save your behind. They save my behind on many occasions, because when you walk into a hospital, it's not always that you can apply what you read out of that book. Sometimes the person that's been there for a long time knows that there's something better that works than what you read in that book. And that's what this reality, and that's why I had to have you on, sister, because, you know, it would be easy to have a show full of doctors. You know, that's what we typically do in situations like this, to talk to the doctors. But at the end of the day, I know my experience in not only my own office, but in any clinic that I've ever worked in, any hospital I've ever worked in, the number of people that I could have taken care of would be very limited if it wasn't for the nurses, if it wasn't for all the different people that work, the people that draw the blood, the people that do the x-rays. How can you, if you are so important and you had to do that all yourself, you'd be able to take care of maybe one or two people a day. It's your order as a doctor that is important. I'm not going to take away the importance of a doctor and the training and the things that we learn. But once you make a decision for a patient, once you decide that this is the plan that's going to happen, there's somebody else that's by that person's bedside most of the day, most of the night. And we come in and out, we check, we evaluate, we may give some more orders, or we may say everything is good. But it's the nurses that do most of the bedside interaction with people on a minute by second, by day, by hour basis. And it's very important to hear from your perspective. I think that's why it was so powerful.
Praise be to God. And I just need to say one thing about that. There has been a plethora of times where I've had to advocate for my patients regarding with physicians. For example, when you work at a teaching hospital, you don't run into your attendings a lot. You run into a lot of residents. Residents, at that time, you have more education than them most times. Experience and education, your nurses do when you're residents. But those are the residents who are doing the discharge paperwork, who are prescribing the medication. So as a true story, when I say find you a primary care provider that looks like you and take charge of your health, I've had plenty of patients, Black patients, who were prescribed lisinopril. Well, 7 years ago, we still was deliberating over research about lisinopril, but they know now that lisinopril causes angioedema in Black people. Right. So here you have a patient who comes in, they have hypertension emergency, and they've never taken any blood pressure medication. And here's this resident getting ready to send this patient home with lisinopril. Well, here is your nurse who looks like you, who's going to say, this is the first time this patient's ever taken anti-hypertensive medication. Can we please prescribe something else other than lisinopril? Because we do know that can cause angioedema.
Yes.
So it's a beautiful collaboration.
Absolutely.
Mm-hmm.
And for those of you who are not in the medical field, there's one thing I learned very early in my career, and that is a drug rep is no different than a person that pushes any other thing in society. The majority of the studies on medications, on treatments, on surgeries, or anything like that were not done with us in mind.
That's right.
The actual learning of medical procedures, dentistry and in medicine, were done on Black people with no anesthesia. The book Medical Apartheid by Harriet Washington goes in depth on a lot of these things. But the point that I'm getting to is that even these medications that they say are for Black people, like Bistolic, is supposed to be for Black people. Just think about what happened just the other day. The FDA said that they wanted to pull all ranitidine off the market. How many years have we been giving that to people? And this is what happens when things are thrown at people and doctors just run with it and don't ask any questions and don't respect the fact that there are other people in hospitals that have a lot of experience that can help us. And so that's the thing. So, sister, thank you very much. You're going to stay and hold on for a while, right? Because we might have some questions for you a little later. Yes. I see a whole lot of people shouting you out, but also thanking us for making sure that you were here. Hey, look, y'all, we on this show, the Ultimate Wellness Group, we try to get rid of all that. I'm not perfect. You know, I gotta improve myself, but that's what this is. This is a collaboration of people. The Ultimate Wellness Group is not just about one person. It's about building a reality for us to take Black health and make it better across this country and across this world. And tonight is just an example of some of the people that are part of this. We are growing together, we're working together, and we have plans to do things to make sure that your health is better taken care of. So thank you, sister. Don't go nowhere. We'll be right back with you in a few minutes, okay? Thank you very much for your commentary. Okay, so brothers and sisters, there's going to be something that you heard from sister, and you're going to hear again tonight about what is killing so many people. And so I'm going to give you a little information about that before we move on to the next brother, because I want to make sure that you all are educated, right? That's why some of y'all like to come back, because you want to make sure, you know, there's something I got to do first. I forgot this part. Y'all check this out. Check this out and see if you think this is just happenstance. I'm coming to you, Dr. Pratt. Give me just a second, my brother. Y'all ready? Check this out. Oh, don't tell me it's not going to work. What's happening?
If you have a fever and cough or sore throat, stay home.
I'd say 95% chance this was manufactured, came out of a laboratory.
The source of the virus was traced back to drug testing done at Genesis Laboratories in San Francisco.
A lab technician, now known as Patient Zero, was accidentally exposed to retrovirus ALZ-113, an Alzheimer's trial drug that was being tested on chimpanzees.
The infected chimps showed signs of erratic and aggressive behavior that led to their escape from the facility.
The now famous incident on the Golden Gate Bridge, a 6-hour standoff with police, ended with the apes disappearing into Muir Woods.
Emergency rooms are being overwhelmed with patients showing signs of what's being dubbed the simian flu.
The CDC is projecting a fatality toll ranging from 5 million to as many as 150 million in the next 6 to 8 months.
Anyone showing signs of a contagious illness will receive special treatment here. The airport's purpose-built quarantine center.
Many of the new arrivals are children who have lost contact with their parents.
Mandatory quarantines have sparked civil unrest. Families are being ripped apart.
Containment is not very likely.
Prepare your families, know your evacuation route.
The survival rate is now approximately 1 in 500.
Violence erupted in the city center tonight, the third incident in as many days.
Martial law has been declared in 28 nations, including the US and Canada.
Reactors overheating. Can't stop a meltdown.
Our generator lost its power.
The collapse of anything resembling civilian order due to the extremity of the simian flu crisis. All regular government functions have been suspended indefinitely.
Those who are killed by the virus will probably die in the fighting. So maybe this is it. This is how it ends. Pretty soon, there won't be anyone left.
So I had to just give y'all a little theatrics there, right? But it's kind of amazing, right? You can go back and you look at a movie from that many years ago, And there's so many similarities to what we're dealing with right now. I've been saying ever since those movies came out that the monkeys was really black people and the person that was writing that. So I don't know what y'all think, but I thought that was pretty significant to what we're dealing with. So let's go into a little bit of learning a little something, and then we will move to our next guest. Okay, let me get this movie up off here. So the system that is pretty much taking the biggest and the worst hit in our bodies is the lungs, are the lungs. And we have talked before, right? You all have seen some other pictures. So this would be the tube that's coming from when we breathe, right? The big tube that we breathe through is called the trachea. And then it starts to break down just like branches of a tree, smaller and smaller and smaller, until you get to this, which we would not be able to see with our naked eye. Over here on the left side, you see normal alveolus. And so the cells are normal. And as I've said before, you have little cilia that actually help push stuff out. So if you have mucus or anything like that, you push that out. And that's why we do that in the morning, or we'll spit up something from occasionally. That's cleaning out these surfaces. And you see the different type of cells. We're not going to get into all that. This is a immune cell. And all these systems in here really just is talking about the oxygen that we breathe in, and we exchange that oxygen into the bloodstream onto the red blood cells as the carbon dioxide is released from the red blood cells, and we breathe that out. What is killing most people with the COVID-19 is that this whole system is going haywire into a problem that's called ARDS, acute respiratory distress syndrome, which we don't know a lot about. Most of the time, this happens to people who are extremely sick with very serious medical problems. And once this starts to happen, the whole body starts to shut down and people go into multi-organ failure. When we say multi-organ failure, we're talking about the kidneys, the heart, the liver, the brain, the aspects of the body that you can't not live without. And so this is what's killing people. So why did I want you all to see that? Because I want you to have some understanding of what we're going to be talking about tonight. Because again, sometimes when we start talking to each other as healthcare professionals, we start talking in all these words, but we want to make sure that you all understand it. But I want to make this very, very clear. The people that you are listening to tonight have studied and are practitioners. We've studied virology. We've studied our patients. We've seen many patients with viral illnesses. That's why I can say the things that I've been saying over the last few months. That's why they can come on here and feel comfortable with the things that they're going to say. And so some of you that are out here that are making comments about this is a hoax and this ain't nothing to be worried about, you should really cease and desist and be quiet and let those of us who know what we're doing speak to our people. And this is a warning that I'm saying to you all, because I care about my people and I don't like the fact that we are dying at the percentages that we're dying at. There's a scripture in Ezekiel that talks about getting information from God. And if you share that with people, then the blood is off of your hands. But if you're given quality information and you keep it to yourself, then the blood is on your hands. But I'm saying those of you who have no place in opening your mouth and acting like you're a doggone expert, some of these people that you have influence over that die, that blood is on your hands. So I hope you're ready to deal with that. But my suggestion is people that don't know anything about virology, that don't know anything about how a virus affects people, because those of us that you're listening to tonight, we've seen people with Guillain-Barré syndrome. We've seen people with hemolytic uremic syndrome. We've seen people with ARDS. It's horrible. Like my sister said, we sometimes have to call people in the middle of the night. Your loved one didn't make it. That's not an easy thing. But those are the type of experiences that we have had that gives us the right to come before you and do the best we can to educate you. And so I'm suggesting that a lot of you people out here on Facebook, Instagram, on social media in general, that are making these comments about this ain't that and this and what it's not, start looking at some of the people that are dying that maybe you shouldn't have opened your mouth like that. And I'll say something else. There's no way that 5G can do this. This is not 5G. I'm not saying 5G is good, but this problem that I just finished showing you, that's not coming from 5G. And I want to just real quickly review something that we talked about before, and then we're going to go straight to our next guest. This is what I talked to you all before about how the liver, the kidneys, the lungs, and what's not shown on here is in the intestines. They are all involved in this ACE system. And so what we're seeing as a pattern, and that's why you haven't heard me speak about this specifically, what I'm talking about today, because we haven't gotten this type of information until recently. But this virus has to be made by people in some laboratory because it's attacking systems that we've never seen any virus do before. This ACE system is in the liver, it's in the kidneys, it's in the lungs, it's in the brain, it's in a lot of parts of the body. But how can a virus attack these things? So here's a statement right here. If you look down here at the bottom, it says it has been recognized, and they're talking about recently, that the organs that are included in this ACE system is the brain, the kidney, the heart, the liver, the pancreas, reproductive organs, the skin, and the gastrointestinal tract. And so this virus is kind of concentrating on that system. And that's why we're seeing such horrible things, but especially horrible things with the lungs, because the ACE system is very highly tied to lung functioning. And so without any further from me, we're going to bring on our next guest, my brother from Chi-Town. This brother has been doing a lot of good work in the community. Is not just a doctor that cares about himself and is, living out in the suburbs and enjoying his life and only enjoying it with his family. This brother does a lot of work in the communities in Chicago. This brother is somebody that I highly respect because of that. He doesn't shy away from saying the right things and attacking the things that need to be attacked so that our people are given more of at least a viewpoint. We know we're not going to change these people that make decisions, but what we will do is point the finger and let them know that we see you. And this is the type of brother that stands up like this. He's not a punk. He's not going to sell out for the money or prestige or for some accolades. And that's why he's here with us tonight, because that's the type of people we got on tonight. People that take our people serious, people that put our people first, and people that are going to tell you the truth. So let's listen to this brother, ER physician, dealing with a bunch of black people in Chicago every day in the emergency room. So this is the type of person that you have to understand, knows what he's talking about, first of all, and secondly, he's going to tell you his experience and tell you what he thinks you should do. So brother, Dr. Abdullah Pratt, tell us a little bit of, first of all, about you and how you came into medicine, my brother.
Yes, sir. I want to first off just say thank you for having me on, Dr. Akili. I also want to thank your former guest, Sister Nurse Tamara, just for sharing those wise words. It's truly an honor. We rarely get a day off or a break away from the front lines. I will say that, we're staring right into the face of the devil, when we are looking at this virus. I would first off start by wishing everybody, the best of wishes and prayers to you and your families, because as the last few weeks have progressed, I've noticed that some of the very people who may have been vocal, may have doubted whether this is a real virus, are now the main ones inboxing me about advice for a loved one that I may have taken care of or maybe at another hospital. So it's encroaching further and further upon us all. So I really do pray for everybody, and I pray that, we can escape this without losing too many of the people that we love. I wanted to first start by saying, I'm from the South Side of Chicago. I've never left this place. I'm one of those people you read about that really never really gets outside of there until recently in my adult life. Just made 31. I've grown up always really questioning the pain and suffering that I've seen in my community. Before I had a word to articulate for what we now call healthcare disparities, I always understood that there was a problem with the fact that our aunts and uncles died very early, multiple family members having to have their feet cut off for unknown reasons, the stroke rate, the high blood pressure, the heart disease. People, even when I was a child, I had young friends who missed so much school that they had to be held back because they were improperly utilizing the medical system for the asthma and sickle cell, to the point where they were just in ERs all day, all night, 2-3 times a month, to the point where it affected their own scholastics. But at that point, I asked why. I was one of those children that asked why a lot. And people started encouraging me. My father, may Allah be pleased with him, always said, look it up. That was his mantra, is you go look it up. There's an encyclopedia set over there. You figure that out, or you dedicate yourself to a career where you can address these things that you claim to be so concerned about. I went to University of Chicago for all of my medical training, for medical school, residency as an emergency medicine physician, and now I'm an attending and assistant professor of emergency medicine. But my biggest joy is trying to find ways to really fight for our community. And for those of y'all who aren't from Chicago, the University of Chicago is surrounded on all sides by Black communities, outside of maybe a little pocket of Hyde Park where the Obamas may have been from, also where our beloved minister stays as well in Kenwood. But nevertheless, I'm constantly reminded of why I embarked on this journey. I'm also constantly affected by being in that same community for which I grew up. My older brother, Rashad, was murdered due to gun violence when I was a medical student at the university. I didn't take any time off at that time. I pushed through. When I finally took some time off, the one thing I dedicated myself, other than my own health, was for a new level 1 trauma center to affect the same violence that impacted him. But nevertheless, I've lost many, many friends, family members along the way due to gun violence and everything that you talk about. So I think that this is very on time. The striking thing that I really want to encourage everybody to understand is that these issues, whether they're poor health conditions, poor health outcomes, the diabetes, the high rate of heart disease, the high rate of infant mortality, the disproportionate ways that breast cancer affects our people, all the way now down to COVID, do not represent truly separate entities. They really represent separate manifestations of the same underlying systemic problems that you so eloquently have spoken about. And that's really the fact that from our point of view as a community, we are not empowered or knowledgeable enough to really take care of ourselves. Even those of us who are providers, even those of us who are the leaders in the community fit into that category. So this is a we thing, not a you thing or a who thing. And also our system has had a constant foot on our backs. There's constantly been an inertia and a momentum of resistance, white supremacy, whatever you want to call it, that keeps us in the place that we're in. So any strides that we're making, we're fighting against that inertia at all times. And so that manifests itself in every imaginable way. When we talk about the COVID virus and how it spread out of China to America, the first warning signs that we got, excuse me, were that it would disproportionately affect people with cardiovascular disease or heart disease. It would affect people with weakened immune systems, whether that's diabetes, lupus, sickle cell, cancer patients on chemotherapy. It disproportionately affected the elders, right? And so for me, that was already a whistle. That said, okay, it's coming for your community. It's not an if, it's really a how drastic, and it's when. And so when I first heard the people who really spread this thing about Black people can't get it, I knew that that was another factor that was going to hurt us more, because now instead of preparing, when you hear that your enemies are coming, or you hear that the cavalry's coming, instead of preparing, you let your guards down even more. So that was one thing that I understood was going to impact us. And so as it's now spread, like I said, some of those same people, unfortunately, that were on the front lines that were in doubt now are the ones who are noticing it. It's your grandmother, your grandfather. I'm having those conversations on the front line via phone because we isolate everyone, so that when that patient's about to go on life support and I'm making that decision to place them on life support, normally when you can have that interaction with an entire family bedside, you can make this decision together to even say, do you want this as a treatment? Do you understand the risk? You understand what this means, as you all have talked about, in terms of your mortality and the odds of you dying going up and up and up every minute and every day that you spend on that ventilator. It's comforting for us as a physician to know that, okay, I'm not forcing this on you. We're coming to this decision as an informed decision so that we can all move forward. We no longer have that now. And so now I'm having phone calls with people telling them, hey, are going to be forced to place your family member on a ventilator, do you have any things that you want to say to them? And they're like, yo, they were just walking, talking. How is this possible? How is it possible that they just went because they had some mild shortness of breath, and in the past 3 or 4 hours, now you're telling me that I may never get a chance to speak to my mother again? What's really going on? And so I think that a lot of the confusion, the anxiety, the worries that we as a community have about what's happening in this pandemic are justified. We have more than enough history to look at to show that the healthcare system lets us down, and even furthermore, will use us in a way that harms us disproportionately to others if it benefits others or if it benefits the pockets of some. And so I think that now is more time than ever for us to have a voice like yours and platforms similar to yours. But I wanted to walk people down with the specifics. I see a lot of people with questions in the chat room in terms of when to come in, what does it look like? What's the process? What are the misconceptions around testing? Who gets tested? Why you don't get tested? Who gets admitted versus those who get sent home and feeling like, hey, was this a waste of an appointment, et cetera. So I wanted to give you a chance. I didn't know if you had any direction of that, or if not, I'll jump straight into it.
Do your thing, bro. This is your platform.
Yes, sir. So when you first have symptoms, so for one to start off of the COVID-19 virus, as Brother Dr. Keeley eloquently explained to you all, the COVID virus is named SARS because, it attacks your respiratory system. It's a virus that we thought only attacked your respiratory system, but now we see it attacks the whole body. So for many people, it does start off as just a mild flu-like illness. But I want to say even furthermore that many people don't have any symptoms and are walking around as carriers or vectors of the virus and able to spread it to anyone, especially those at risk. So this isn't the time to think selfishly like, hey, I feel great, I'm gonna go out party, everybody's home, it's time to kick it and turn up. This is the time really to take heed to protect others and to think selflessly instead of selfishly. So for one, 80% of people who contract the COVID virus do not need to be hospitalized. So that may explain for many of you all why you're going and getting turned away, or why you may not be getting testing for that. The next point to know is that testing initially was very limited because our country did not heed the warnings from China and did not opt for some of the testing kits that were being used overseas that were already into mass production, like in Korea and other places. We ended up wanting to develop our own. So by the time it hit us as a country, we were already behind the ball, and we've been working to catch up since that point. So testing was limited. So everything that you've seen in the media, whether it's testing capabilities, the protective equipment for doctors, nurses, et cetera, and the policies that the CDC has to release are not necessarily safety-based as they usually are, where you get one mask, your N95 mask, you use it, you better throw that thing away when you're done. Even going back into the same patient's room, you wouldn't reuse it just because you didn't want to contaminate and they were meant for only one use. Now you got to use them for a week, or you got to use them indefinitely, or keep them in a paper bag. That's not for safety. That's for resources. So this is a resource-driven plan that you're seeing. The same thing goes with testing. So the testing initially was saved for people who the testing would change how they were treated. And so if you were getting admitted to the ICU, et cetera, we weren't really thinking about how widespread this virus is. We didn't have the luxury of that like other countries did. We were thinking, okay, well, how do we know when somebody's no longer infectious? How do we know if this is actually the COVID-19 that's causing this person's illness? Should we test other people who are at high risk in terms of that weakened immune system or pre-existing conditions? So that drove the initial pathway in terms of in the emergency departments, who was being tested and who was not. As it stands right now, if you were to walk into most emergency departments at big universities, you'd be segregated between people who have flu-like illnesses or influenza-like illnesses, they call them ILIs, versus those with none of those symptoms. If you don't have any of those symptoms, you end up in the general part of the ER. You kind of have a similar experience that you normally would if this was not a pandemic. For all of those who have anything ranging from shortness of breath, runny nose, cough, fever, even diarrhea, nausea, vomiting, you then go to the emergency department side that's fully isolated. Everybody's in full protective equipment with the presumption that you have it until proven otherwise. And so that gets us into another issue, which was for many people, this question of how are people being diagnosed with the COVID before they even have a test back that says that they're positive. And so as a doctor who thinks worse first, and for those of you all in the emergency department, that's my specialty. Right, I don't have as much knowledge maybe on basic healthcare as your brother Dr. Keeley's going to have. I'm not going to have as much knowledge on brain surgery as a brain surgeon is going to have. My job is to know a little bit about a lot of it, especially when it's in emergency situations. So we always think worse first. If you come in with chest pain, my mind is what are the things that are going to kill you, not necessarily what's the most likely thing that's going on. That's what we'll get to. We'll get you to close to a diagnosis, but I can't let you leave me if there's risk to your life that I haven't dealt with already. So in the emergency departments, we're thinking, okay, you have COVID, you got these symptoms until we prove otherwise, and we'll try to prove otherwise if it's important enough for your health. So now we think about what are the risk factors that you have, and do you need to be admitted is the next question if you're somebody with those symptoms. That's the next first question. Are you going to go home, or are you going to need to stay? For most people, that's based on your initial vitals and then your chest x-ray in the context of your risk factors and how fast you may decompensate, or a better way to think of that is how strong is your body, your lungs, your immune system to be able to fight this off if we were to send you home because of lack of resources and trying to really prioritize those who are the most ill first. So the things that I'm looking for usually are your oxygen saturations. So when they put that thing on your finger, it's called a pulse ox. It has little red lights up your finger. That's measuring how red the colors are that are transmitting through that device. And the degree of red is correlated to how much oxygen is in your blood when it's attached to the heme molecule or the hemoglobin in your red blood cells. So the higher that is, the better. 100% is where we like everybody to live. Anything less than 90%, when you're just breathing normal air, becomes concerning, because if you're at rest at 90%, you go walk around, the odds are you're going to drop down into the 80s. And people who live in the 70s, if you ever see that, that's someone who usually is going to need higher airway advanced techniques, whether that's a big BiPAP mask or nasal cannula or a tube in your throat like we've been talking about. The crazy thing with the COVID is we've been getting what we call happy hypoxic patients, meaning hypo means low, oxic means oxygen, so hypoxemia means low oxygen in the blood, the emia. And so these hypoxic patients are literally living at like 70%, some of them at 60%, to the point where we don't really believe our eyes when we're looking at your vital signs, but yet you're happy in the moment. But what we've noticed is that those people drop off a cliff oftentimes in the next 3 or 4 hours, which explains why some of you all would see family members that look okay, and then they come into the ER or the hospital, and then all of a sudden they're on life support. The next measure that I really look at is how someone is mentating. How awake are they? How conscious? Are they sharp as attack as they would normally be? Or are they starting to become a little bit confused, exhausted, saying things that are incoherent? That means that they're not delivering enough of that oxygen to the brain. Now the brain is being affected. And so now as an ER physician, if I want this person to have the best shot at living, the next step is, do I need to intubate? And now in the context of everything going on with COVID, some of the things that we used to be able to do to temporize somebody and, avert having to put them on the ventilator have been taken away from us. So the BiPAP machines, which are those big, pilot looking masks that you may see some people have, it looks like a CPAP machine, which is very similar to it that some of you all who have sleep apnea may be using. That helps us in the medical community avert so many intubations and putting people on ventilators that would have happened, let's say 15 years ago before we used that back in the 90s, where if you had bad asthma, COPD, heart failure, you were coming in. If you weren't doing okay on regular oxygen, we were going straight to a tube. Nowadays, we have a lot of temporizing measures, so many more people don't end up on vents and they don't suffer those complications of being on a ventilator. So now I'm looking at you. Are you hypoxic? Are you mentating well? The next thing that I'm going to usually have back is the chest x-ray. So when we look at the chest x-ray, we're looking to see if you have signs of a viral pneumonia. Now, pneumonias come in as sort of viral or bacterial. They look different on the chest x-ray.
Right.
Bacterial looks like what we call a consolidation. It's kind of like a more dense area where mucus, etc., white blood cells, all of those things are really focusing on one part of the lung, as opposed to a viral pneumonia, which can be kind of spread out all over the place. It can be a little lacy, etc. But in the case of COVID, we are seeing things that in the healthcare professions we don't normally see at all, which are these multifocal opacities. They call them ground glass multifocal opacities all over the lungs. They look like little clouds. If you took a cloud here, a cloud there, threw them all over the lungs, and now that has become very, very specific for the COVID diagnosis. So most of my patients, if I had, my whole paycheck, I'd probably, which ain't much at an academic institution, but my whole paycheck, I would be able to put on most of them that this is a person who has it, especially when you are critically ill before I see that test result. Oftentimes the test result is an afterthought, okay? Just because of that x-ray, taken in context with their symptoms, if you're hypoxic and you're still doing okay, all of these things are a constellation of symptoms that help us as the physicians understand, okay, this is somebody that we need to really take a close look at. We need to, not send this person home, wait for the test to come back, but admit them and almost preemptively treat them. And that gets people into when you're being offered trial medications, the ventilator, all of these different things while someone is still talking in front of you, which for a lay person or someone who's not trained in medicine can be very, very confusing, especially if you have a doctor who doesn't understand, your culture, how you think, understand what kind of terminology that you're used to hearing. And they may either purposely or on accident talk over your head, use unnecessarily big words to describe what's going on, almost as if they don't understand the medicine enough themselves. The minister always says that the true measure of intelligence is not how much you're able to recant, but really how well you're able to take complicated concepts and bottle them up and be able to feed them to a baby, almost in that sense. So those who can translate and say, okay, well, this is what's going on, it's akin to this, or an analogy would be X, Y, Z, to help people understand what's going on so that the family can make a decision. But as I said, the family oftentimes isn't even around and in so much shock that they have almost been taken out of the decision-making process, which again add more and more layers onto what's going on. That brings us now to the point where if we do have to place a tube in you, I've been trying to really stave off how often I put people on the ventilator until it's absolutely necessary, even though early on the data was telling people you should intubate early, just intubate based on the numbers. Even if somebody's talking, mentating well, that was something that for most of my colleagues, especially here on the South Side where we deal with only African-American people for the most part, we do have, some other populations, but 90% to 95% are all Black, are all, low socioeconomic resources. Most of the time we have been trying to advocate against that. It hits us in our gut to be able to say, this person's talking to me, this person is right there with me. It feels just counterintuitive to place them on a ventilator. And now as time has gone on in the ICUs, like our sister was telling you before, some of the doctors, the intensivists are pushing back and saying the longer you can keep these people off the vent, the better, which is something that we've known the whole time. It was just in the panic of everything. I don't know if that got misconstrued from some of the data from China, et cetera. But that was where we end up going with things. So if you get admitted, you can either get admitted to the regular floors, which is just general medicine, or you can get admitted to the ICU because you need too high of an oxygen requirement, or you need, or you're intubated, or you're starting to go into sepsis from other things, or you're having multi-system organ failure. So these are the things that we all have to really, really keep in mind. And it's usually during this process where physicians start really asking you if you would like an experimental medication. Okay. And so I wanted to really pause there because that's pretty much a really good overview of what happens in the ER. The fact that we are here dealing with this every day, the numbers are still going up. And where I'm at, it's our people. It's the elders, and by elders, I really mean 45 and up, because with the average life expectancy being 15 to 20 years lower for African Americans, you at 50 really represent possibly 65 to 70-year-old in terms of the impact that your lifestyle, the environments, the stress and everything has taken on you. So I really wanted to see where you wanted to segue with it after really laying it out as well as I probably could.
Well, thank you very much, bro. I hope all of you. I know my brother is he was running down some stuff to y'all, but I mean I think it was a beautiful presentation because that's the thought process of what's happening when people are walking in these doors. And just real quick, when we say ICU, we're talking about intensive care unit. That's when we as physicians think that a person's status is in a place where they need to be continuously monitored. When we put a person on a regular floor in a hospital, we know that that person is too sick to go home, but somebody doesn't need to be standing there watching over them the whole time. Somebody can check on them and then go do some other things, check on some other people, and then come back and check on. When you're in the ICU, somebody has to have their eyes on your heart monitor or other aspects that's going on with you almost continuously. They may be able to walk away for a minute, go check on another patient, but they're coming right back in just a few minutes to check back on you. That's how bad your body and the shape that you are in, that you could die within seconds. You could code while we're sitting there looking at you. That's how bad you are when you're in ICU. I saw another statement where somebody was asking about, could a person in these type of situations decide that they don't want to be intubated? But let me make this clear to you all. When we as physicians are looking at a person and we make a decision that they need to be intubated, they're not sitting breathing like we sitting here. That's the way they breathing. Pain in their chest because they're working so hard to breathe. They're lightheaded. They can't think correctly. They're all over the place. They're very anxious. They think they're going to die. So when we say intubate a patient, we're not talking about no average everyday stuff that like the general population is seeing. I'm just going to be honest from my perspective. When I have been in situations like that, my butt is real tight. I'm talking about what I defecate out of is real tight. And you are trying to grab every thought in your mind, all the patients you've seen, all the things you've read, all the things you've heard, all the things you've talked to your colleagues about, trying to come up with a way to keep this person from getting intubated because we know how bad that is. We know what the statistics say. So we're going crazy as well. But we have to keep ourselves in a certain perspective to make sure you don't go crazy further because we're going crazy. But it's not one of those type of situations. When we walk to a patient and we start talking about intubating, believe me, that patient's not going to fight back. They're in such horrible shape that they need some help, and they will accept anything we give them. So I think you did a wonderful job of doing everything, bro. There's a question here that's about stats. Janine Muhammad, what we're going to do is we're going to answer that at the end. After I let everybody, do their talk about their experience, we're going to come back and answer that question later. So if we get to a point to the end of the show and I haven't answered that, please let us know. It's about 1,000 diagnosed. Let me see if there's anything else that we want you to touch base, bro. I'm going to let this other brother come in and we're going to all four get back on here and answer some of these questions, okay? How do you build your O2 in general? Okay, we'll come back to that. All right, brother Pratt, we're gonna go ahead and pull you off, and we're gonna pull the other brother up. We're gonna come back in just a minute, just in case there are any questions. Is there anything else you want to say before we move on?
Yes, sir. The one other thing that I would tell people, I think I saw a couple of questions in terms of what do not intubate and all of that stuff. That would almost mean that you're being made comfort care. So if you didn't want to be intubated, that would almost mean to us like, okay, so we putting our hands up and if whatever happens at this point. And that's the last thing you want for your people, because we also see the other side of the fence where some people are upset on these new guidelines that are being put out in terms of who gets prioritized for a vet if you were to come in, meaning that if you come in with a lot of comorbidities and a lower chance of survival, say you're 75, hypertension, heart disease, all of that, and then someone who's 60 comes in with less of those things, and you all equally need a vet in their low resource, that person who's 60 right now with the way the protocols are would get that vent. And so I want you all to really understand and take this as seriously as possible, protect our elders, in terms of transferring one child from one side of the family to other for daycare or any kind of activities like that. They are just vectors, and that very many people who don't have any symptoms at all can transmit it. And we're seeing families now. We're not seeing just one person. We're seeing a husband and a wife back to back. One's already in the ICU, the other one's coming. We're seeing mother-daughters come in with these illnesses. And now we're seeing in-laws come in and saying, hey, we were all at dinner together. The child came from one house to the other. Now both sets of grandparents are all in the ICU. So I just want to say everybody take precautions on that, and hopefully, we can answer as many of you all's questions as possible. Some of them are very simple. So I'll let Dr. Keeley, whenever he's ready, we can get to some of those questions with yes, no's, or simple answers.
Yes, sir. What I'm going to do right now, bro, I'm going to bring Sister back in with both of you. This question right here from Roxanne Coleman. Do you think administering nitric, I think she's probably saying nitric oxide is a good modality for COVID ARDS? What have you all's experience been?
Sister Tam, did you want to answer that? I can go.
Yeah, please, brother, answer. I haven't seen it.
No, we haven't used it. The nitric oxide can definitely activate a little bit more of the dilation of those blood vessels, especially around, your body. It's something that's naturally produced by the body to dilate blood vessels to help with blood flow. But until recently, we were thinking that necessarily blood flow wasn't always the issue. Until recently, new data has been coming out saying that people clot easier. Some of these blood vessels around their lungs and other organs may be affected. It's something that, maybe we should definitely look at. But there are a number of trials going on at different hospitals, different institutions. And so each one may be different. So just really listen closely to what people are saying. The other part of nitrous oxide that it does do is it can lower your blood pressure as well. Whenever you dilate blood vessels, you're going to lower the blood pressure itself. So many times, as Sister Tamara was really mentioning, we're battling a balance game between, giving you the type of life support that you need and also keeping your blood pressure elevated. Many of the sedatives that you may need to be on that vent lower that blood pressure already. And so really using, any nitric, anything, whether it's nitric oxide or it's nitroglycerin, tabs or anything like that, you have to think of the negative side effects, not just the positive windfalls that you may be looking at. And that's our job as physicians, to really look at the whole spectrum. So that may be explaining why that's not being used.
Excellent, excellent. Okay, y'all, we're going to go ahead and run to my last doctor, and then we all going to get back, all right? So thank you very much. I appreciate my brother's patience over here. I got to do a little introduction with this dude, man, because I've been knowing him for a long, long time. Actually met when we was walking into medical school, and I had only been there for a year.
Literally.
I was on the interview committee, and I met my brother. He came from Southern University. We won't knock him at us Prairie View people, but right, we're still in the SWAC. But there's something I want to really say seriously about my brother is that we've maintained our friendship over all these years. And there's one thing that I respect about him, and I would like for you all, I'm gonna put his information up in a minute, but follow him, because his brother's very, very, very about his actions. There's a lot of times when we hear Black people say things about what they about and what they do and yada, yada, yada. But sometimes all we have to do is just not worry about what they say and watch what they do. And this brother is not only Frontlines in helping the Black community in Baton Rouge, but he's run for office. He does all kind of things in the community at the schools. He can rap. Now, I think I get him in that rap, but he does. The hip hop doc, right? He sings, plays an instrument, and just in the Baton Rouge community, this brother is known for being there for the people, and that's why he's here tonight, because he's in another part of the country, right? We heard from Memphis, we heard from Chicago, now we're hearing from Baton Rouge, and go ahead, introduce yourself and tell the people how you got into or went towards medicine, my brother.
Well, first of all, peace and blessings to everybody that was on, man. You got some sharp physicians. I'm so proud of those guys. I'm 51, so they're youngsters to me, that the nurse and the young ER doc, so they're babies to me, but they are so bright and intelligent, and that's what our future should look like. Keely, you and I met at med school hooping and Kappas and Alphas, but at the end of the day, man, we became brothers, and man, I appreciate what you're doing and trying to educate the community. So those compliments go a long way, because I always looked at you as a big brother to me, and I definitely appreciate what you did. And I tell people the story about how you took care of me and Corey Hall when we came to Meharry, and that's one of the reasons why I'm a physician today. But yeah, guys, I'm Ronnie Whitfield. The name's spelled a little different, but it's pronounced like Ronnie, and they call me the hip hop doc because I use music and medicine to educate kids on health issues. And so, you know, that's just one segment. A lot of people I got laughed at, and people didn't understand why I was doing the hip hop thing initially, but it was just my way of trying to reach young people. And it's gone from being laughed at to becoming a spokesperson for the National American Heart Stroke Association. I just did a recent PSA type of thing for them about social distancing. And so multiple experiences, met many people, but what I enjoy doing most is coming on platforms like this, trying to give the truth to the best that I can to people so that they can live healthier and longer lives. And so hopefully I can share a little knowledge. I think my nurse and my ER doc kind of killed it, man. They stole all the thunder. So
did.
Hopefully I can give them something else they didn't talk about. They did it though, brother.
Yes, they did. Yes, they did. So go ahead and just tell us about. We know you are in a pretty close proximity to New Orleans, which is one of the hot spots in this country. And before I get to that, I want you all that are listening to do a little thought process, because this man Fauci, a lot of people are lending his words to a large degree of what they think. Right? This man has been talking about what cities are going to wind up in trouble, and it's happening. Yep. This doesn't happen in unpredictable ways. He's making statements and people that predict things because they're part of making it happen. Yeah. So, of course, New Orleans is a hot spot right now. New York is a hot spot. Yep. Right now. You know, we're expecting other places like DC and Philadelphia to be hot spots because of what he is saying. And if we watch that happen, then we know this is a little more controlled than we can lend to the typical virus. And there's also something I want to say about brother Dr. Pratt said earlier. He was talking about these things that we're seeing. This is not what we expected 15, 20 years ago when we were dealing with even serious viral illnesses. Right. So we're definitely dealing with something that's changed. And I believe 100%, everybody else can speak for themselves, that this is a proof that these things have been tainted and manipulated by humans. But all that to say, bro, New Orleans is a hot spot. Mm-hmm. You know that New Orleans does have, very poor diet, high degree of high blood pressure, high degree of cancer, high degree of heart disease. But what has been your experience in your city, Baton Rouge, which is pretty close?
So it's been pretty consistent with both your previous guests. And, before we even delve into that, I wanted to just make a couple points. The healthcare system really is not designed as the way it should be as a primary care doctor. We're doing tertiary medicine. We're treating the heart attack after it happens. We're not preventing things. And so what I admire most about what you're doing, Dr. Keeley, is trying to teach people how to live healthy and happier lives. And you mentioned earlier that you hadn't been sick in a very, very long time. And it's because of the things you're doing to build your immune system. But we got to look at why our people are getting sick. We're talking about a population of people as Blacks, African Americans, however you want to refer to us, as those that are living paycheck to paycheck. We're least likely to have paid time off and sick leave. We're least likely to have a cushion, what do we call that, economic cushion to live for 6 months and not be worried about going to work. And so we're also less likely to have access to healthcare and insurance. And then there's the implicit biases that are in the healthcare system, where Blacks are treated less aggressively and later in the stages of the disease process because of the differences between the races. And so when you got these ER doctors that are running these places, and now you got a family member who's walking into this emergency room without any support, anybody that can help them, and all you can do is maybe FaceTime them. This is a scary, scary situation. Two of my friends have lost their moms in the last week to this COVID-19, and they all had underlying health conditions. 70% of those who've died in the state of Louisiana that were African-American had at least one of the underlying health conditions, hypertension being number one, diabetes being number two, and chronic kidney disease being a third. And that's the bread and butter stuff that I see every day in my primary care practice: hypertension, diabetes, chronic kidney disease, high cholesterol. And of course, they say, well, a lot of that's preventable and treatable. But if you're in a situation where you're living paycheck to paycheck and you got to choose over going to the doctor and not have any health insurance, because many of these folks don't have insurance, or taking care of your family, that's what you're going to do. And on my way to work this morning, I saw 13, 14 guys that killing no mask on, working on the side of the road. Out of the 13 guys, 7 of them were Black, and the other was some brown brothers, some Hispanic brothers. And so what are they going to do? They're going to go home. So they're around each other. They may get exposed to the virus. They're going to go home to a small environment. They're not living in big houses, so they can't self-quarantine. They're not even aware of the symptoms. And so they're spreading that virus to each other. And so, you know, putting out the message of social distancing sounds really, really good on paper, but how realistic is that for some of these families? This so-called stimulus that they're about to release, man, that's not $1,200, $2,400. Man, come on. That if you can stretch, and we stretched it in middle school, Vienna sausage crackers, ramen noodles.
About the program, man. Don't put that.
Well, you know, we did what we had to do to live, you know, and some people have to do that, unfortunately. And so when it comes to surviving, you do what you have to do, but living, and you know, you mentioned diet of several times on your program. I think that's the crust for where we need to get, but it's hard for a lot of people to reach that. So my goal has been to educate people as best I can, how to live on a budget, how to exercise without gyms, because you can do that. The world is your gym. There's tons of things that you can do without going to the gym and not being able to afford the gym. And so COVID-19 has this pandemic, I was not shocked. It's not alarmed. Everybody's going bananas. Oh, black folks, oh my God, it's killing. What do you expect when we have the highest rates of hypertension in the world? We have high rates of diabetes, high rates of obesity. Louisiana has the worst healthcare statistics in the world. Now, we rank number one when it comes to obesity. You know, we rank number one when it comes to infant mortality in mothers and mortality in pregnant moms. So, but when it comes to, you know, day-to-day living, brothers just trying to get it how they live, as they say in the streets. And so many times healthcare is put to the wayside when you got to feed your family and take care of your bills. And so, again, platforms like this need to be bigger so that everybody can hear the truth and the real messages that can save their lives.
And on that point, for all you black men that are on this show, let's get rid of that foolish idea that I'm hustling all the time. I got to get out and get it. And you better put some work into your damn health, or your family's going to be out here without you. And then what?
That's a man. A man is going to get checked.
Go ahead.
A man's going to take care of his health. That you know, the first, you know, they and I don't know about everybody's spirituality and where they are, but in my house it's God, and then it's me, and it's my family. My health comes in all of that. That's and right. So some people believe in the CDC, but I believe in the God. And so, you know, I have to take care of my health first so that I can provide and take care of my families. And so, men, when you make an excuse for not going to the doctor, that to me is not a good excuse. A man is somebody who believes in take care of himself. In order to take care of his family, you have to be healthy. And not just healthy, well, let me say well, mentally, spiritually, physically. We need all those pillars of wellness together to create a whole person. So many people talk about health. Health just means the absence of disease. That means you don't have hypertension, but you may be bipolar. You may have some mental health issues that are going on, or you may not be financially secure. And all those things put you at risk for having health problems because you are stressed out. Cortisol levels increase in the body. There's many, many things that we could discuss, but we, as men, I just want to make that point. Go to the doctor, get yourself checked. Find somebody that looks like you, that cares about you. My nurse said it perfectly earlier, that people that look like us tend to take better care of us because inherently we care about our people.
And on that note, let me say this. If there's anybody from New Orleans that's on here, I'm not saying that you can't find a good doctor in New Orleans. I don't know if you can or you can't. I don't know of any. I take that back. I do know some. Yeah. But the point that I'm getting to it from a primary care perspective, if you live in New Orleans, Baton Rouge is not a place to travel to get somebody like this brother who's going to care for you.
45 minutes.
Getting to. We got to get away from thinking that everything has to be so damn convenient. We shop convenient. It's killing you. We do convenient. It's killing you. We got to get outside of that and start putting the effort and the work into good health. So I'm just giving my brother a shout out. If you in the New Orleans state, it wouldn't be too much for you to travel to see this brother and the other people that are on here as well. That's why I have their information up there so that you all can follow them on social media. If you have questions, we the type of people that's going to give you the answer.
Right.
Now, we don't need you to try to hit us up and try to get free care, because this is how we take care of our families. But at the end of the day, if it's just general answers, just general things like we're talking about today, that's why all these people are here. This brother's been waiting since the beginning of the show. That's a dedication to you all that are on this show. So you have to show some dedication back to your own health. And I'm saying that, and I mean to be able to take this idea and move it to every place that any of you are. If you know somebody that's quality, that cares about you, they've proven that to you. If they 2 hours away, make it a day. We're going to travel to this doctor and get our health care from somebody that we trust, rather than spending your money and paying your money and giving your insurance to doctors that don't give a damn about you. Right. And you have the right not to allow that to happen. So let's start to improve our own ability to keep ourselves in control of our health by making the right decisions, learning the right information. As I said, and every time I have one of these shows, to be able to apply the information that we're learning today. So tell us.
I want to make a point, and you told a story earlier, and I think almost every Black physician could tell that same story about a patient who came to them and then went to a white physician to get a second opinion. And that very thing happened to me, but it also happened where a white patient left my practice and came back to me because of the bedside manner and the care that I provided for her. And she told me, she said, I'm embarrassed to tell you that I've never had a Black physician, and I was intimidated by the presence of you being in the room with me, and I didn't know how to handle it. So I left you. And she said, I'd never been treated nicer by anyone, and that's why I came back. And so, not bragging, but that's a testimony to Meharry Medical School where I was trained. They put a lot of emphasis on bedside manner and taking care of the patient holistically, and not just, just looking at numbers. And, there's 200,000, 240,000 people that might die. We're over 23,000 people in America that have died from this COVID-19. But these people have names, and I can identify these people. So it means a lot to me. And that's why I'm here. And that's why I didn't wait, Akila, for the show. I was listening to those very intelligent physicians and the nurse that you had previously, because I wanted to learn as well, because there's a lot of knowledge coming from both of them.
That's right. And that's one of the points that I made earlier. I mean, that just proves to you all what I said earlier. None of these people on this show today are arrogant enough to think that we know it all. We're going to be very confident. And that's why I had all of them come on. All of these people that you're listening to tonight, that you're getting to know, are very confident people. I'm a very confident man. But when I don't know, I'm going to say I don't know, because I refuse to put information out here or tell people things that they're not going to be able to use, that they're not going to be able to put into their lifestyle and it give them some benefit. I'm not that type of person. I could have been a millionaire if that's the type of nigga I wanted to be. But I wanted to be a Black man that treated my people correctly and give them a chance to make it in this world. So go ahead, bro, and tell us what do you think about the testing and its availability in your area, and just taking your situation in your city and kind of take it out to maybe the whole country. We know that for sure. There's research that I've done with doctors and healthcare practitioners around the country.
Right.
That, of course, there are more Black doctors in areas that have a higher Black population. That just makes common sense.
Yeah.
But what we're also seeing is that there are more deaths, more sickness in the inner cities, and there's less sickness and less Black deaths in the outskirts of cities and more in the countryside. But when it comes to testing, there were hardly any tests at first, which makes sense. Anytime something's new, we don't have necessarily tests. And now we have tests that sometimes takes 5 days, sometimes 48 hours, sometimes 72 hours. And now they got this quick test, which you can get within 45 minutes to an hour. What has been your experience with that? And in your experience, do you believe that the reporting is accurate? Are there people dying and they're putting this coronavirus on that death and it really wasn't from coronavirus?
Right.
And are we saying that people have it based on symptomatology and they really haven't had a positive test? What's your experience with those realities?
First, in a nutshell, there's not enough testing and we're limited. So we were given criteria the first 3 weeks. It was based on if you weren't having any symptoms, you could have a known COVID-19 positive exposure in the ICU on a ventilator. You could not get tested unless you are 60 years old and a healthcare provider, or 60-year-old with symptoms and chronic underlying conditions. And so now that's changed a little bit, but we still don't have enough tests. So it's almost like you're rationing out the test and figuring out who you're going to test. There have been some false negative and some false positive tests as well. So the test is not perfect in itself. I will tell you, though, that when this virus hit, China was already engaged and had testing. So the ball was dropped from this current so-called administration that we have. So we could have had enough tests to handle the business. I think there was an article I read, Dr. Keeley, where they sent supplies from the U.S. to China to help them, knowing that this could actually come over here.
Yes. And
eliminating the pandemic team, there's all this politics and stuff that's going on, but eliminating the pandemic team, we weren't able to localize and find that one case, and contact trace and take care of all the stuff. So now you got a novel virus that nobody has immunity to. And so it's spreading like wildfire. An incubation period of 2 to 14 days with no symptoms in most people. And 80% of the country will be asymptomatic or pre-symptomatic. So by the time they have symptoms, and for our viewers that don't know this, coronaviruses are the viruses that cause the common cold. There are no cures for viral illnesses that we know of. And interestingly, one of the protocol medications that they're using is zinc. You know, they're using zinc, something that we can get from our diets, from lentils, from beans, you know, things that we can do in a healthy diet. It helps prevent viral replication. It helps this drug called plaquenil or hydroxychloroquine get into the cells. And so we don't have enough testing in my state right now. And until we get enough testing and statistics are released on ethnicity and race, we're not going to really be able to come up with strategies to handle this now and in the future. Right now, we do need to respect the behaviors that they're asking us to do: social distance, hand washing, very simple things.
Absolutely.
And we got a president that's the so-called president that's rushing to open the system for an economic reason. And you know, that's a whole nother discussion right there. But there's a chance that if we do that too soon, we're going to have another spike in this virus and more people are going to die. And so it's up to us and our leadership, and hopefully these governors will buck this guy and say, hey, it's not time to open it up. I did get word today that possibly this could be extended until the end of May, but we'll see how it goes. But as far as testing, Achilles, no, we don't have enough testing right now. I'm still limited. I think we have 200 rapid tests. Positive results come back in 5 minutes, negative in 15, and they were rationed between 100 for outpatient and 100 for inpatient. You're talking well over 70, 85, 90 doctors that will be potentially referring patients throughout the day to get tested. So we're definitely short on testing right now.
Yes. And let me just say this, for those of you who either believe this or don't believe it, think I'm crazy, I'm gonna say it anyway, because I speak the truth that I believe is the truth. This is part of a depopulation program, brothers and sisters. There's no question around it. None of us that you're hearing tonight that have been practicing medicine for many years have ever heard or seen anything like this, because it's not natural. It's not a nature thing. This is something that has been manipulated. So I'm warning you all that I would suggest don't get tested. If you have mild symptoms and you can stay at home and quarantine yourself from other people, which you should be doing, and you don't get to the point where you start having shortness of breath to a point where you think you're going downhill, fight it at home. We're going to give you some ideas in a little bit about what to do. But getting tested is putting you in a database of people that they're going to have first line when they get ready for this vaccine. Believe me, the vaccine is coming. And that's why
it may be mandatory. They say it may be a mandatory vaccine.
Exactly. And that's the point. So if your name is on a list of those who have been tested, you're going to be first. They already have your information. So be careful. Be careful with getting the test. I'm not saying don't get tested if you're in a hospital, if you're doing bad, if you're in a situation where you start to have respiratory problems. It would be good for the physicians that are taking care of you to know that. But just to go, if you have a runny nose or you have a cough and you're pretty much doing okay, to stay in your home and do the best you can to boost your immune system, because we cannot trust. We never have been able to trust this medical industry as a unit. You can trust these people that you have here tonight, but the medical community in a whole has never been on the side of Black people. Tuskegee experiment is just a drop in an ocean of what has happened to negatively impact Black people all over this country. So be very careful, you all. Don't just run out here and think that everybody has your best interest just because they're setting up testing sites around some of these hospitals and some of these medical centers and some of these public places. Do not go there unless it's a necessity. And we can talk about that some more when we bring everybody back.
I want to make one point too. And you said we never seen anything like this, and I didn't think we would. But in 1918, W.E.B. Du Bois went back and forth with a white, I think he was a business owner, about the Black folks being inferior biologically, that we were biologically inferior, and that the Spanish flu would wipe us out.
Yes.
And so there was a very interesting newspaper article, and I do for you guys that are listening, I do a Black History moment every morning. I just call it history, American history, because it's a part of the history of this country. And most of it is about what happened in America. Some of it is about our kings and queens in Africa, but it's mostly about here. And in that article,
by the way, real quick, bro, it's right there. Y'all see the thing, the day after 2016, follow that, because that's what he's talking about right now. Go ahead, bro. I'm sorry.
Yep. Every morning I post something, guys. And it started off after I'm here where Alton Sterling was killed, and it was motivated by his death. But now I got so worn out. I could post something about a Black man being killed by the police every day. So I started to post Black excellence and stories in history that we didn't know about. But all that being said, Keith, I lost my doggone dog. That show at 51 years old, I need to do something to give my memory back. Give it some ginkgo biloba. But, oh man, I lost my thought, brother. But it's all
You'll
good.
get it back. You'll get it back in a minute, bro.
It's all good. Oh, so talk about the flu and genetic inferiority.
Yes.
But W.B. Du Bois went back and forth. So long story short, the black folks did not die as much as they predicted. Matter of fact, they fared better than white Americans during that time, the Caucasians. And so many factors and many reasons why that could be. But you got to think at that time we had lack of resources, lack of access to health care. That's why we had to have our own doctors, own hospitals, own nurses. And we still died from it, but not as much as they predicted. It's less than white folks. And so that's because of multiple reasons. But again, it shows that it proves that what we already know. And this, I'm preaching to the choir, and I'm talking about that we as people are not genetically inferior to anyone. As a matter of fact, we're probably superior. But that was the thinking that they had.
Do it, black man. You got melanin in your skin. You superior.
We are.
And that ain't something we got to walk around and boast about, but it is the truth.
It is what it is. And so for people to think now that
stronger your mind.
Right. And for people to think now that this virus is attacking us because we're genetically inferior, no, but we do have high rates of hypertension, diabetes, chronic kidney disease. We do have lack of access to health care. We do work job to job, no paid time, less likely to be able to work from home. So these are the reasons why we're dying from this disease. It's not that it's just attacking us, because it's killing. You know, I've had a few white patients die as well that have chronic underlying conditions. I'm in the South, where we fry everything from butter to Oreo cookies. And so, you know, we are setting ourselves up for death on a day-to-day basis. And that's real. That ain't no joke, brother. That's real time. So, yeah. But that was the point I wanted to make. I'm sorry, too.
No problem. It's all good, bro. Hey, look, for all of you, I've seen some really good questions. I want to answer this, the one I want to deal with, the one. As a matter of fact, I'm going to try to bring it. Let me see if I can bring everybody back.
Okay.
So look, we just gonna go at this, y'all.
How y'all doing?
You doing, brother?
Y'all are amazing. I'm so proud of you too, man. It's amazing to spend some time with you guys. Thank you for allowing me on the show.
Hey, I say the same thing. It's an honor to be with all of y'all. These are my people, y'all. So the question was that she said that something about there have been 100,000 tests, 3,000 deaths, and 10,000 recovered. What happened to the other 90,000? So y'all go ahead and take a stab at that.
Who wants to go first? I have my thoughts on that.
I'll give it a shot. I'll keep it quick. I mean, the real answer, like you said, is as professionals, we don't know. We don't control those tests, and we don't control the results until we have our own hospitals. You won't know. But what I would imagine is that a lot of those people represent. To me, that sounds like that 80% of people who don't need to be hospitalized, right? So if you're not being hospitalized, you're almost kicked out of the data set. You just go back into the community, you self-quarantine, and then that's how it is. Now you take that 20%, and those numbers sound a lot like the 20% that then gets broken down into people who end up admitted and recovering versus then those who end up in the ICU who may still be battling this. And then there may be some who ended up on life support and unfortunately passed.
Anybody else?
I would just say I don't trust the numbers. You know, I don't think they're releasing the numbers to us. Fortunately, we had a few governors that were bold enough to put those numbers out, like in Chicago and in Louisiana. I think Michigan did as well. But we don't have accurate numbers, so I'm not quite sure where these tests are going, how many people have actually been tested. They released rapid testing on the weekend, and then Monday I was getting calls. I didn't even know the rapid tests had been released to our hospital. So I'm not even sure who's being tested and how often they're being tested. So I'm not very confident about the numbers. The only thing that I know for sure is that we do have underlying health conditions. We usually rank high when it comes to diabetes, chronic kidney disease, and hypertension. And so until we can address those factors,
yes,
we're going to continue to die from not just COVID-19, but from living day to day.
That's right.
Yeah, and that's also why I started for all of you here. That's why I started what I started with. Just because we're paying more attention to this virus doesn't mean that people still aren't dying with heart attacks.
Right.
Still aren't dying because they had diabetic ketoacidosis. Aren't dying because of kidney disease. And everybody, no matter where you live, the majority of the people that are walking in and out of these dialysis centers are Black people.
That's right.
Who are sick. And let's also, you know, we have to take some responsibility as Black people. Damn near everybody on here, if you eat pork, you know that's no good for you.
say
If
that.
you don't drink enough water, you know you should have changed that. If you sit your behind down all the time at work, driving home, sit at home, drive back to work, sit at work, drive back home, sit down, you know you should be doing some activity.
Yes, sir.
Let's take a lesson from this and start to use these type of people that are trying to give you information to do something better for your health. We cannot keep blaming somebody else for the things that we do by being hard-headed and not listening to the good information that's being exposed to you. Every day on a regular basis, somebody is on social media or somewhere trying to do something in the communities. I know all of these people that you're watching are doing things in communities on a regular basis to get information to our people to improve their health.
Right.
But are we using it, or are we making excuses, being happy, being in habits, or using the excuse of this is our lineage, this is our tradition? Yeah, well, tradition will put your black behind in a box. And if you're not trying to go there, it's time to change.
Dr. Keeley, I want to say that since most of the nurses are ones who are administrating this test as well, like giving the tests, these tests are registered with the CDC. You know, we put them in a computer, your local health department and things like that, like regularly like a STD test would be registered. So just they're registered with your demographics, your name, your age, your race, you know, things like that. So they have the data. And I agree with Dr. Whitfield. I don't believe the data either. You know, and early on, no, we did not have tests either. We were told every 2 weeks we're getting a test, we're getting a test, getting a test. And most of our level 1 hospitals or trauma 1 hospitals don't even have a test. We have test sites. We have test sites that people actually go to.
Right.
We'll get the test, like Dr. Whitfield has said, once the patient has been admitted to the ICU and they're symptomatic. And then we give them the test, and at our level 1 hospital don't even have the capability we have to send that test out. So it takes 5 to 7 days. So we've had experiences where the patient's actually expired. And then finally the results came in.
Wow.
So we have to stop this anxiety over the test. And we all heard, both physicians said, even Dr. Whitfield said there has been some false positives, some false negatives. This is not bulletproof. There is no cure and there is no definitive treatment. So, and like Dr. Whitfield also said, we have to get to the basis, the root of this problem, and that is working on our health. There is hope here, working on our health, you know, attacking obesity. Obesity leads to diabetes. Obesity leads to hypertension. Obesity leads to the rest cascading to end-stage renal disease. So we got to get back to choosing life versus death.
That's right.
And getting better, you know. And we do have those help aids. We really do. I pointed those things out. We really do.
Okay, so this is what I'm gonna do next. For anybody, the question about what to do in your house with your other care, I'm gonna address that in a minute. But what I want to do first is I'm gonna just take a few minutes and I'm gonna talk about the things that I think we need to do as Black people. And I would like for each of you to do the same thing. And while we're doing that, you all let us know if we missed any questions so that we can address those once we finish this. So I'm going to say this. I talked about my top 5. The number 1 is good thoughts. You got to get off social media, get off the news, stop getting inundated with this madness all day, every day. Go to whatever it is that the name is, the God that you serve. Pray, think positive, read your scriptures, whatever your activity is to give you positivity, do that every day. Think good thoughts. Think I'm going to make through this. I'm going to do the things to improve my health while I'm sitting at my house. I can do exercise in my house. You can still go to the park, just practice social distancing.
Right.
Right? Number 2, you got to be hydrated, y'all. You got to drink water and hydrate. The difference in those I do in my other programs. So I don't want to spend too much time, but learn the difference between drinking water and hydration. They're different and you need both. Number 3, you have to eat nutritious foods. It is a misconception that just do big vitamin C or just do zinc or just do, no. The human body works as a system. The heart works with the lungs, with the kidneys, with the liver, with the intestines, all of these things, the brain, all of these things work as a system. And nutrition does the same thing. Now that's why I keep saying we need to have navy beans.
Yes.
We need to have vitamin C rich foods. You need to have vitamin D rich foods. You need to have all the berries. Citrus fruits. Here it is that people are sending me this video of this guy talking about drink tonic water for quinine. You can get quinine in grapefruits and in all the citrus foods.
Right.
We'll concentrate on foods and stop thinking about these things that people are talking to you about. I had a lot of people tell me about this Indian woman. I think she was Muslim. She had her head wrapped, but she was talking about the things that she suggested. But she talked about buying zinc tablets and vitamin C tablets. No, get the food. The food is in the preparation that God put together for your body. So when you go to the store and you get organic food, let's not make no excuses, because we got a lot of people that talk about they can't afford quality food, but yet a bunch of people were standing out in lines last week to get the new Jordans. For real? In this climate that we live in right now, you're going to spend your money on Jordans instead of putting some good food and cooking for your people? We have to start accepting some of our own responsibility, right? So quality foods, concentrate on the vitamin C, vitamin D rich foods, but all good fruits with seeds in them, navy beans, and your good vegetables. Cauliflower, broccoli, cabbage, Brussels sprouts, asparagus, okra, eggplant, and squashes. Those are your best vegetables. Get those in on a regular basis. The fourth thing, you got to get outside and do some activity. Immune systems are boosted by the foods I just finished talking about the good thoughts, but you also have to be moving. A sedentary person does not have the best immune system. And then the last one, as far as my top 5, would be rest, which is 2 parts to. You have to fast if you're an adult, and you have to get some rest, meaning in the bed rest. For our children, try to get them to eat as much time in between, but they shouldn't be on 1 meal a day, and they shouldn't fast if they're less than 16. But adults, fasting boosts your immune system. I've done show on fasting, so check it out if you need to. But those would be my top 5 things. When it comes to social distancing, I just want to show all of you a picture real quick about this respiratory droplet. Again, this is what it looks like when somebody coughs, when somebody speaks, when somebody sneezes. Okay, every single one of us have been in the company of somebody and they're talking and you see spit fly on you. The virus is in that spit. That's called a respiratory droplet. The virus is in that spray that you see right there. And so when they talk to us about being 6 feet away from other people, that is somewhat science, and sometimes they say even be further, but that's what you're looking at when a person coughs, talks, or sneezes. The respiratory droplet has the virus in it and it's spreading to you. But also, as I've said in my program previously, that we have to take in consideration that it takes a number of virus particles to infect you. You're not going to get infected with a virus, coronavirus or no other virus, with 10 or 20 viral particles. Your immune system will kill that, the weakest immune system. If you get 50 or 60,000, 100,000, a million, and your immune system is still in good shape, the likelihood is you can stop that from causing disease in you. So let's make sure that we are practicing social distancing. We can't belittle that reality.
Yes.
And that's why we had today's show. You listening to 4 people who are seeing Black people all over the country in dire straits because they're not paying attention, or they think this ain't gonna happen, or this is some hoax. We got to change our perspective. We have to get serious about keeping our distance from people. Right. And I would venture to say that everybody that you're listening to today practiced that before coronavirus, because we don't want to get infected with your crap, whether we're in good shape or not. And at the end of the day, look, all of you that are listening, if you are a smoker, if you drink, if you have kidney disease, if you have liver disease, if you have lung problems, COPD, if you've been smoking for years, if you have diabetes that's not in good shape, you need to practice social distancing more than anybody else.
Yes.
Stop acting like you are in a shape that you can do what you want to, not in this day and time. It is our responsibility as healthcare practitioners to tell you the truth. And the truth is, until this thing dies down majorly, you have to continue practicing social distancing. But if you're any of those things that I just talked about, a smoker, a drinker, or any of those medical problems, you better act like you can catch this and it's going to kill you. And if you act like that, then you'll be in better shape. But for you to ignore these things and just walk around in society and do whatever the hell you want to. I don't give a damn what your age is. If you're a teenager and you think you're invincible, when this puts your behind in the hospital and they start sticking that tube in your throat, you're going to wish that you did something different. I don't pray that that happens to anybody. I'm just being very clear. So one of you, well, how about we go sister first, brother, and then you.
Yes, sir.
What's your suggestions, my sister?
You said it all, and so both doctors. Thank you. You said it all exactly. I have seen patients admitted 27 years old with no prior medical history, just obesity, and she was ventilated. You know, I've seen it. I've seen sickle cell patients who have not had a sickle cell crisis in over 9-10 years, but here they are. So it's very important. If you already have a chronic illness, take this very, very serious. Smoking is a risk factor. That's a death lifestyle that we live in. But most importantly, I think that's what's taxing the healthcare system right now. That's probably frustrating a lot of your physicians and doctors, is that we've been talking about the same thing over and over again. You know, good, healthy habits, lifestyle changes, you know, which have led to COVID-19, exacerbating all of this in us. We've been talking about this, you know. COVID-19 is very important, but so is your cardiovascular disease, you know, so is your diabetes, so is your hypertension. These are things that is curable and preventable. Just because your mother had it, it's not hereditary. You weren't born with it. What you're passing on is a lifestyle. It's not hereditary. You don't have to have your limbs cut off like your mother. This is this diet that we are passing on that is not our diet. Ask yourself, where did it come from? You know, where did it come from? You know, and yes, we are at an economic disadvantage. Yes, we are. But we got to get back to the basics. You know, buying some seeds is $1.39. Plant them out back. You'll have all the good fresh and fruits and vegetables that you need. Go buy your fruit tree. They $4. You know, get back to farming. Get back to producing food for yourself and your family. And this couldn't be the better time than ever. You know, they're talking about pouring out milk. Farms are wasting food today. You know, we've been warned. You know, their time is coming. You know, there possibly the economic. You talk about crisis. You know, if the economy don't get back together, we're going to be looking at famine. So let's put some seeds and some food out back. Let's get back to that. You know, producing our own food. So there is this.
Yes, ma'am.
I also want to say this, Dr. Whitfield and Dr. Keeley. I saw an article just recently that was in my email regarding COVID-19. That was that, of course, we know, you both know, because you studied also a lot longer in pharmacology, that vaccines is supposed to eradicate the disease.
Right.
Now we have what you call the flu shot vaccine, but it did not eradicate the flu.
That's right.
You get it every year.
Get it every year. Well, I don't, but
well, no, I'm saying, you know, we get the flu every year, you know, and it's not going away. It hadn't left for sure. Not like polio.
Exactly. So I mean, the trust in the healthcare field to believe that COVID is going to be eradicated. But getting back to the article that I read, the article said that COVID more likely will revisit us. It is a virus. That is the article that I just read. That is the new research that's coming out of the CDC, that this will revisit us. So I see this as a time for us to get our act together, get up, exercise, lose that weight, get rid of obesity, get rid of that death lifestyle, get rid of that slave so-called soul food diet, get rid of it. It all leads to, yes, black eyed peas is not meant for us. Every other race on the planet has their own diet, has their own culture. And I'm going to tell you, we have one for you that is your culture, that is your diet, and it works. Dr. Whitfield, you keep saying you're 51 years old. I ain't going to tell you my age, but I'm 10 plus 10 plus 7.5 plus 7.
You're 32. We're 32 years old. She never ages. She don't change.
But I can just tell you that you can reap the benefits if you adhere to this dietary law. It's called the How to Eat to Live. It is a prescription for us.
Y'all see that? Y'all see that?
You got a prop up very nice. And it hasn't changed. The knowledge hasn't changed. It's the same.
It has.
Brother Muhammad wrote it, it hadn't changed yet.
It has not changed. You know,
Right.
so I know we're listening to all this stuff on Facebook about CMOS. I don't know nothing about CMOS. Or I don't know what you call it, that allergen, that bacteria. I don't know nothing about that. You know, in your ginger shot. But I do know something that's very affordable and simple. The bean soup, navy bean, you know, that is non-genetic modified. You can't get more quote unquote organic than that. That's you know, right. And that does work. And those that do adhere to that dietary law can be a bear witness. I'm not saying that I'm perfect at it by no means, but I strive at it and I have reaped the benefits. You know, my oldest child is 25 years old and I was not a teenager. Like I said, Dr. Whitfield, I'm
she gonna throw it in my face now, Keith. You look very youthful. That's all I want to say, Sister Tamara. Look very youthful.
Be to God. Thank you. And that's from striving to adhere to that dietary law. That is our culture. That is our culture. Yes, sir. So that's all. Thank you, Dr. Thank you. And Brother Dr. Abdul has left us, but thank you very, very much.
Yeah, he just hit me up. He said he had to go. He had something to do, but we thank him. And I'm going to give all my shout outs in a minute for everybody that helped me with the information. Go ahead, Brother Ronnie.
Just look, piggybacking on everything you said when I say,
hey, bro, we don't do no piggies here, man. Come on now.
Let me I'll be back on what you said. When I speak to young people, I try to make it as simple as possible. Or Sister Tamara, and to my listeners, I say, you know your doctor. We got to establish a relationship with somebody that cares about you and looks just like you. Know your family history. And we talk about history. The reason I do history post every day because we're supposed to learn from the past so we won't repeat it in our future. And so you got to know your family history. So if your mother had diabetes and hypertension and heart disease, you're at risk, but you do not claim that. Does not have to happen to you. And that's why we're talking about the diet of healthy living and healthy eating right now. Know your numbers. That means you need to go to the doctor with the notepad and pen and paper and be responsible for what you paying somebody for. Like Dr. Keeley said, we got to eat too. So you're going to come in with your copay. You're going to pay your insurance. We might cut you a little break, but we got to eat too. But when you come in, you hold me accountable. You ask me, well, Doc, what was my cholesterol? And what do those three numbers mean? And how do you get the total cholesterol? What was my blood sugar? What was my A1C? You need to have that information and you need to write it down, log it, journal it, and keep up with it. And then, of course, eat healthy and exercise. And encompassing in those two things comes the meditation and prayer. Comes the hydration and drinking water, more water, and getting rid of these sodas and that type of thing. So we could go on, but I think Dr. Keeley hit all the points that I wanted to make. But I will leave you guys with this. If you don't come out of this self-quarantine and this stay-at-home shelter without a new hustle, in better shape, better looking, have gotten closer to the God, whatever God you call your God, meditation and prayer. If you don't come out of this better, then that's on you because you have an opportunity. I know we're struggling right now and financially some people make it, but some kind of way, Black folks always seem to come out of it.
Yes.
I remember post-Katrina. One of my partners, man, he called me and said, man, Doc, man, them dudes and broke into the everything was shut down. So they broke into a store and they were barbecuing until the levees broke. Brothers just find a way to survive when they have to survive. So but we should come out of this, and I say that jokingly, tongue in cheek, but we should definitely come out of this better than we came into it. And so that's by listening to this show and any other advice that comes from Dr. Keeley and Sister Tamara. We should definitely come out of this better than when we came into it. So you guys take advantage of this free time or this extra time that you have to read and to meditate, to pray, and to study and to learn more about yourselves and your bodies. And I mean, everything that Dr. Keeley said is pretty much, he stole all our thunder, Sister Tamara, he took it all, but that's it. I mean, the hydration, the sleep, meditation, rest, all that stuff, we got to do it all together. A holistic approach to healing and wellness is how we need to be living.
Yes.
Yes. Well, I want to, first of all, thank everybody that has come, everybody that stayed, everybody that shared the show. Completely 1000% appreciate you. We've been here for a while, so I'm not going to get to all the comments. I will address your comments personally when I come back. But I want to give an extreme show of gratitude to my sister Tamara, to my brother Ronnie, to my brother Abdullah. These are people that I consider my friends. These are people who I respect, and I would not have brought them here in front of you all if that wasn't the case. I also want to just shout out a few other people because the information that I have been speaking, they covered everything, but I reached around the country to get information. So I just want to mention the people that did do the survey that I put on Facebook. or I called, or they just have given me information through our little survey that we did. And so that was Dr. Winston McIver and Dr. Cornelia Jones in South Carolina, Dr. Mike Dury in Baltimore, Dr. Earl Clement in rural Texas, Dr. Yusuf Adamola in Nigeria, Dr. Lenora Bullock and Kiera Muhammad in Atlanta, Dr. Beth Carter in Detroit. So I saw you earlier, my man from college. I would forget his. I can't forget his name. I'll get you in just a second, but that's my Detroit brother. Chicago was Beanie Muhammad and Dr. Abdullah Pratt. We had Sonia X Wyatt in Las Vegas, Sharon X in Charlotte, Marie X in Raleigh, Michelle Muhammad in Charlotte, and Tariq Muhammad in Richmond, Virginia. These were all the people that took time to answer the survey and also to give me information to make sure that the information that we gave you tonight was a good viewpoint from the whole country, because I don't trust the media. And so I went and did my own research to make sure that the information that we give you tonight is applicable to you as a Black person. And what I know for sure, I, Dr. Whitfield, Dr. Pratt, and my sister, it doesn't make a difference the color of the person that walks through the door. We're going to do our best to take care of you. But I would be lying if I didn't say that my focus is to take care of Black people first, because ain't nobody taking care of us. And I know they all would agree with me. That's what we're trying to do, is give the best to our people. And that's why we came here tonight. We spent so much time. I thoroughly appreciate you all's time out of your busy schedules. I know you guys got something either today or tomorrow or sometime soon. You're going to be right back on a shift. We all will be right back doing our thing tomorrow, but I really appreciate it. I think it was a great show. I think, you know, for all of you that send me videos of other people, take this show and send it out. Break this down and send to people. All right. I don't knock anybody sending me information. I don't knock other people out there trying. But when it comes to Black people, you're looking at the best right here at the Ultimate Wellness Group Transformation Tuesday. So send this to people. Tell people to come to this site. Tell people to follow our brothers and sisters and get the type of information that will save your life. So I'm done. If you all have anything to say to our people as we get off, bro. And sis, I thoroughly appreciate you all. And this is not going to be the last time where you guys are going to come on and put some of your expertise out here to help our people.
Sister Tamara, anything?
No, sir. Thank you. Thank you, Dr. Keeley. Thank you, Dr. Whitfield.
Yes, thank you guys both. I really enjoyed it. I hope we shared some knowledge and hope people take heed, man. We're gonna get through this. This too shall pass. This too shall.
Yes,
that's right. So again, thank you all for coming in. We pray that you got some news that you can use. Understand that in a society like we live in, it takes a lot of work. It takes hard work. It takes dedication and diligence to have good health. So as my brother said, make sure you come out of this better than you went in. It's going to be up to you. Y'all have a good rest of your evening and a good rest of your week. And we'll talk to you later. Peace.
Peace.